Welcome everyone to the 9 months progress report. I would like to present my PhD theme, which is Management of Itching in the Treatment of Chronic Spontaneous Urticaria and Prurigo Nodularis. My name is Andrea Lancz and I'm a first-year PhD student, and I'm also working as an internist in the Department of Internal Medicine of Markosovsky Hospital in Szombathely. I will make my PhD with the help of Department of Dermatology of Semmelweis University. As you can see, I have a lot of helpers. My vision is that patients with prurigo nodularis or chronic spontaneous urticaria could have a better quality of life. Therefore, my mission is to optimizing the treatment of these diseases. Currently, I have 2 ongoing projects. The first one is about comparing the safety and efficacy of biologics in prurigo nodularis. It is a systematic review and meta-analysis. Prurigo nodularis is a chronic skin disease that usually presents as multiple, very pruritic nodules erupting on the extensor surfaces of the extremities and the trunk. It is associated with a significant disease burden, with the majority of patients suffering from depression, anxiety, and sleep disorders. Many associated conditions are known in the background, however, their coexisting or pre-existing role hasn't been established. Only estimated prevalence is available, but the real number of the patients are probably higher. There are numerous therapeutic options, but the conventional therapy's effectiveness is questionable, and some of the drugs may cause serious adverse events. In recent years, new biological agents have been developed, and in cases where the conventional therapies are ineffective or poorly tolerated, the use of biological agents has shown promise. So, our aim is to identify the best therapy for prurigo nodularis patients. Our clinical question is, what is the safest and most effective therapy in prurigo nodularis? For our study, we have used the PICO framework. Our populations are patients suffering from prurigo nodularis, and we would like to compare the biological therapies to the conventional therapies. We will observe the efficacy outcomes and the adverse events. Our hypothesis is that biologics are more effective and safer compared to the conventional therapies. We have carried out a systematic search on the 20th of November with these 2 domains. The first one is about prurigo, and the second one is about all the existing and under-investigated therapies. With this search key, we have found almost 5,000 results, and after the selection protocol, we had 134 eligible articles. Here you can see my some finished and ongoing analysis. We have a total 6 kind of outcomes. We will investigate a wide range of medicines, and just like the drugs, the articles written about them are very different. Taking into this account, a part of our article will be a network meta-analysis. It is not an easy task to process such a diverse data set, so for now I can show only partial results. Dupilumab is the first FDA-approved biological therapy for prurigo nodularis, and in these forest plots, I would like to show this drug effectiveness of the itching. The outcome parameters were the itch scales. This scale ranges from 0 to 10. 0 means no itching, and 10 means worst itch imaginable in every kind of itch scales. In the beginning of the studies, the average itch scores of the patients were between 7 to 10, which is very high. We have selected 11 cohort studies for this analysis, and we have investigated them in 3 different time points. We have compared to the baseline itch scores to the follow-up scores and calculated mean difference. And as you can see, in every different time points, the reduction of itch was more than 5 points. It is a statistically significant result, And considering that in the studies, 4-point decrease mattered significant, it is also a clinically significant result. And I would like to emphasize that the patients achieved the more than 4-point reduction for 4 weeks. After our results, I would like to summarize our strengths and limitations. First, I would like to highlight the strengths. It will be the first meta-analysis in this topic, and it will be a comprehensive analysis of all the existing therapies, and we will investigate a wide range of outcomes. However, we have some limitations as well. The studies are very heterogeneous, and prurigo nodularis is a relatively rare disease, so the sample sizes are usually small, and there are different definitions of the outcomes. Based on our results so far, our conclusion is that dupilumab is a highly effective therapy for prurigo nodularis, and it has a fast onset of action. We have some suggestion for the clinicians. We should suggest the earlier use of dupilumab in the treatment of prurigo nodularis, and we have suggestion in the research field as well. We need more comparative studies, and we need to investigate the long-time efficacy of dupilumab. Here you can see my progress. I have just finished my risk of bias assessment and waiting for my other results. Now let me back to my second topic, which is investigating the safety and efficacy of biologics in chronic spontaneous urticaria. Chronic spontaneous urticaria is defined by the presence of urticaria or angioedema or both for a period of 6 weeks or longer. It is a self-limited disease in most of the cases, with an average duration of the disease of 2 to 5 years. However, active chronic spontaneous urticaria impairs significantly the quality of life. The estimated point prevalence worldwide is 1%. The first-line therapy for this disease is the second-generation antihistamines, but there are patients have urticaria refractory to this treatment. In these cases, the use of targeted monoclonal antibodies are necessary. Omalizumab is the first and currently the only FDA-approved targeted therapy for this disease. Although omalizumab has been an important addition to the therapeutic armamentum for the management of this disease, there are still a significant percentage of patients who doesn't respond to the combination of omalizumab and antihistamines. With the expanding knowledge of this disease, new biological agents are in development, and the preliminary results are promising. So our aim is to find the most effective treatment for chronic spontaneous urticaria. Our clinical question is, what is the safest and most effective therapy in chronic spontaneous urticaria? Using the PICO framework, our patients are suffering from chronic spontaneous urticaria, and we would like to compare the novel biologics to the conventional therapies. We will observe the efficacy outcomes with the urticaria activity score and adverse events. Our hypothesis is that novel biologics are more effective and non-inferior in safety compared to the conventional therapies. Our clinical implication is to achieve the early use of biologics in the treatment of chronic spontaneous urticaria. We have carried out a preliminary search and found many results. Our topic is feasible, so the next step will be the Prospero registration. So in summary, these are my 2 projects right now, and we are hoping to submit these in the near future. Thank you for your attention, and let me say goodbye with the words of Captain Yemi from Black Clover. Even if you think you might lose, you will be fine as long as you don't give up. Surpass your limits, then a path will open up for you.
Thank you for your presentation. I have 2 questions regarding your first topic. Is dupilumab a lifelong treatment, or it can be discontinued after the itching is fading away? And also, does the skin eruptions fade away as well with the itching, or it just decrease the itching? Thank you very much.
Thank you for your question. Well, as I mentioned, we need more studies investigating the long-time efficacy of dupilumab. In the current studies, the patients are under the therapy, so I couldn't answer yet, but I hope I will.
Thank you for your presentation. Is dupilumab available in Hungary?
Yes, yes. Dermatologists can use it, and it's pricey therapy, but yes.
Yes, may I ask about the price? Yeah, I wanted to ask about the cost of this treatment.
It's about $500,000 forint.
Forint.
500,000 forint. The price, and we can give the patient from the moderate to severe prurigo. So the using of dupilumab depends the stadium of the disease.
All right. And what is the mode of action of this drug? Mechanism of action?
Oh, it's interleukin-4 inhibitor.
All right. Thank you.
Thank you for your nice presentation. I would ask a question regarding to your first project. You have mentioned that more comparative studies are needed in which dupilumab will be investigated compared to other biologics. And what do you mean by other biologics?
I mean that nemolizumab will be the most important agents beside dupilumab, and it's currently pending the FDA approval. And I think that we need more comparative studies, the other novel biologics as well, for example, the vixarelimab and the JAK inhibitors.
Thank you.
Thank you.
I forgot one more question. You showed a lot of therapies in one of the slides. And do you have data about all these therapies? So we will see the final analysis later?
Almost all, yes. I have used the case reports, case series, so some of them I will use in the systematic part. But yes, I will have data from the other biologics, phototherapy, and some older therapies, for example, thalidomide as well.
Yeah, and when I looked at the slide, my eyes came to pregabalin, which is like an anti-seizure drug. Could you tell me more, if you have any information, how would this help those patients?
There are many different pathways behind itching, and some of them are the neuropathy behind that, and I think that will be the answer.
All right, thank you so much.
So my question regarding nodular prurigo. So you mentioned most patients with nodular prurigo are on treatment. So is there any patient who develop recurrent symptoms in this group?
Not under dupilumab treatment, but older therapies, yes, but not dupilumab.
Thank you.
Thank you.
I would just have one last question regarding outcomes. From a clinical perspective, which outcome do you find the most comprehensive or the most informative?
For example, the quality of life of the patients. In the preliminary results were very, very good outcomes regarding that. Then we will investigate sleep improvement. I think it's a very important outcome. And the clearing of the nodules, and it will be another outcome, and I think it's the most important outcome besides the itching.
So I can only agree. Thank you very much.
Thank you
For your talk.